A recent study finds the vast majority of U.S. doctors say long-term illness after COVID, long COVID, is a genuine health problem. But only about 7% felt confident about diagnosing it, and only 4% confident about treating it. What's worse, in terms of solutions, the medical establishment is generally grouping vaccine injuries under the heading of long COVID. Today, we hear from a pathologist who may have been among the first to note mysterious blood clots in deceased people who'd been vaccinated. Dr. Ryan Cole is a Harvard-trained medical doctor with a PhD in health policy. What were the main things you were speaking out about?
The main thing was COVID was treatable. Early on, when the word, quote, vaccine came out, I knew right away it was impossible. So I spoke against that immediately, because you can't vaccinate against coronaviruses based on the basic virologic principles and mutation rates.
When you say you can't vaccinate again, are you basically chasing something that's changing so fast it won't be effective?
Yeah, you look at Fauci's holy grail that he failed on, and that was an HIV vaccine. Why? It has a spike protein. It also mutates. It's similar, but not the same, but it's the same construct. You can never catch up with it.
It's interesting because we spoke to some of the experts in the military working on this problem prior to the vaccines being introduced, but they worked on the vaccines. And the chief virologist there told us on the front end kind of what you said. He said, RNA vaccines don't work very well and don't last very long, and if they did, we'd have one for AIDS.
Yes, absolutely correct.
When did you recognize, and why didn't other people, you think, early on that this was a clotting disease?
What was interesting to me is I was noticing during 2020, pre-vaccine, microclots in vessels, and my subspecialty is skin pathology. So I was noticing a lot of biopsies of digits, the fingers, the toes, and there are certain patterns, and all of a sudden we saw an uptick of those patterns. So through the microscope, I saw a lot of clots.
This is with COVID,
before
the vaccine?
Correct. And so I talked to colleagues around the world and asked them, hey, are you seeing this? Yeah, a GI pathologist down in Texas, seeing a lot of clots in my biopsies as well. So it was a subtle pattern we noted. So I noticed early on, and I started speaking out to at least my local community, saying, hey, look, we have a clotting problem with this disease, which far worsened when the genetic injections rolled out.
What did you start to see when the vaccine rolled out in pathology?
Well, that's when I started getting reports from colleagues about clots all over the body and people dropping from pulmonary emboli. I have colleagues in the military talking about young, healthy, active soldiers ending up in the hospital with horrendous clots, sudden death from clots, strokes in young patients from clots.
I'm not a medical professional, but if I were part of a public health establishment that were rolling out a new vaccine or trying to get a handle on a new virus, I would be reaching out and gathering this data, talking to the people that do biopsies and autopsies and also that see and treat the living patients. It doesn't seem like there's any organized effort to do that.
You nailed it, and that's my exceeding frustration. Early on, we treated this as though it were Marburg or Ebola, and so the powers that be and Fauci and others, oh, don't do autopsies, etc. The only way we learn from the death of a patient is if we do that post-mortem examination. That was discouraged worldwide, and even now with people dying suddenly and sudden adult death syndrome and whatnot, the number of autopsies is still abysmally low. So we can't educate the next generation of doctors and scientists if we don't examine. I say all the time, you cannot find what you don't look for.
What do you see ahead?
I see a revolution in healthcare of people, number one, taking responsibility for their own health, and two, finding a new way to seek health.
We spoke to Dr. Cole at a conference titled Back to Basics Summit on Family, Food, and Healthcare.